Good morning, good afternoon, and good evening to all of you, and a happy International Day of Forests. I warmly welcome you to this webinar on forests and trees for human health, hosted by IUFRO, the International Union of Forest Research Organizations. My name is Christoph Wildburger, and I'm heading IUFRO's Global Forest Expert Panels program, in short, GFEP. IUFRO is the global network for forest science collaboration, connecting around 600 member organizations, which represent about 15,000 forest scientists around the world. The core of IUFRO's GFEP program are objective and independent scientific assessments of key issues of global concern. Today, we will present and discuss our most recent assessment report titled Forest and Trees for Human Health: Pathways, Impacts, Challenges and Response Options. This assessment has been carried out by the GFEP panel on forest and human health in the frame of the IUFRO-led joint initiative of the Collaborative Partnership on Forests, the CPF. Before we go into the program of this event, I will briefly share some technical information. As you have seen, this meeting will be recorded and will be available on our IUFRO YouTube channel after the session. And if you have questions to the speakers, please use the Q&A box. Dear participants, the theme of the International Day of Forests today is Healthy Forests for Healthy People. And we will highlight the role of forests and trees for human health in this webinar. Forests and trees provide essential services that contribute to the mental, physical, and social well-being of humans. This immense potential of forests to contribute to positive health outcomes has been undoubtedly established by various studies and research. However, the relationship between forest and human health is complex. Evidence also shows that poor practice of conservation management of forests can contribute to adverse effects on human health and well-being, with the emergence of diseases such as COVID-19, for example, and an increase in natural hazards. International policy processes have increasingly recognized these crucial interlinkages between human health and the health of ecosystems and other species. For example, the recently adopted Kunming-Montreal Biodiversity Framework calls for integrated approaches such as One Health, and the linkages between forest and human health are evident in several targets of the third Sustainable Development Goal on good health and well-being. The interdisciplinary GFEP panel of renowned scientists now carried out a most comprehensive global scientific assessment on the links between forests and human health. Today, we will share the outcomes and publish the report. We will start with a keynote presentation by the chair of the assessment, followed by a panel discussion with leading authors. After their statements, you will be able to ask your questions to the speakers, and please use the Q&A box for that. Well, with that, I'm very pleased to introduce to you Cecil Konijnendijk. Cecil co-leads the Nature-Based Solution Institute, a think tank for the evidence-based greening of cities. He's an honorary professor of the University of British Columbia and a visiting scholar at Wageningen University. Cecil is widely recognized as one of the world's leading urban forestry experts. Cecil skillfully chaired the Global Forest Expert Panel on Forest and Human Health. He will now provide us with an overview of the key messages of our assessment. Cecil, the floor is yours.
Thank you so much, Christoph, for giving the floor, and wonderful to see such a great attendance from all over the world. Just seeing in the chat that we literally are in all parts of the world. So thanks for joining us on this momentous day, the International Day of the Forest, with forest and health as a topic. So what better day, of course, to launch our report than today. So we're really happy to be able to do it. This has been a pretty interesting piece of work, of course, because forests, and not only forests, but actually we also look at trees and green spaces. They are present in all our environments, or in most of our environments. Of course, from the very urban, where most of us live and work and go to school these days, but also to peri-urban nearby forests, as well as more faraway forests that are still the home of forest-dependent communities, for example. And of course, sustainable development goals play in all these different environments, but the health goal is a very important one. And of course, our relations in terms of health and well-being to forest are manifold. And that's also why the scope of this panel has been very broad. We've really been trying to capture all these different elements, all these different aspects of our complex relationships. And I should really thank the panel. This is part of the group that met during one of our final activities. It has been a real pleasure to work with such an interdisciplinary group of people. We have people from fields as medicine, we had people from ecology, from forestry, we had people from landscape architecture, really a whole wide range of expertises, environmental psychology, I should also mention. And the really nice thing, I think, is that we all came from very different parts of the world as well. So we have really been able to give a truly global perspective, as the global forest expert panels are supposed to do. This shows you just a little bit of the work in progress, the working sessions we had, which are often very intense. And the idea with this kind of panel is really to assess the current state of knowledge, to see what we know, in this case, about all these relations between forests, trees, and human health. But of course, also to come up with some kind of key messages for policymakers, and maybe also identify some of the knowledge gaps and areas where we have to move forward. Here you see the report that is also launched today. It's a pretty hefty volume of 230 or so pages, and it will come together with a much briefer policy brief as well, where some of the key messages are highlighted. This is, I think, a really nice illustration that is part of the report. We had the pleasure to work with Karin Grönberg, a Swedish illustrator, and this really captures some of the complexity and the richness of forests, trees, and human health relationships. Anything from livelihood provision, food provision, the issue of zoonotic diseases, but also, of course, things like bringing green spaces and trees into our cities to help us recover, for example, from mental illnesses. So a very complex perspective. And to frame that and to have an idea of this kind of broad complexity, we have used different frameworks that are more integrative than more traditional health approaches. So we use, for example, a One Health approach. We have looked from a planetary health perspective as well as an eco-health perspective. And I'll say a little bit more about that in a little bit. But of course, we know that a part of the reason why sometimes there are some negative effects associated with forests when it comes to health, think, for example, about zoonotic diseases or forest fires. These have very much to do also about, with us, humans, disturbed forest-people relationships. So actually, one of the key messages already here is that we have to rebuild some of those connections, make sure that we conserve and manage forests in the best possible way to also reduce some of those potential harmful effects. And of course, one of the reasons why forests and trees are important is that we have to deal with a lot of actually human-induced negative health impacts. And this figure shows some of those complex relationships. Things like, of course, climate change, pollution, changing land use, changing land cover. And then all of this can play into things like malnutrition, infectious diseases, but also things like stress and mental health issues in general. So I already mentioned that we work from a very integrative perspective. So we really want to move away from a purely anthropocentric perspective. In brief, when it is about the health of people, it's also about the health of other beings on the planet. Actually, it's also about the health of the planet itself. So the One Health approach, which has become more popular during recent years, started off by looking at animal health in relation to human health, but it has broadened the perspective to really say, well, the health of all living beings is really strongly connected. The eco-health approach, which has its root in biodiversity, ecosystem services, and socio-ecological systems, really looks at the health of entire ecosystems. And then finally, the planetary health perspective, not unlike, for example, the Gaia perspective, looks at the health as the whole planet as being very closely related. So there's no doubt that the health of all of us, all beings on the planet, is really closely linked. So Payam Dadvand will say much more about this in his brief intervention after this. But in one of our chapters, we really assess pretty comprehensively the state of knowledge of the relations between forest, trees, and human health. And in many cases, these relations are quite positive. So actually, forests and trees can enhance our health. And what the authors have done in this chapter is to give a life stage approach. So to look at different stages of our life and what role forests and trees play. And this actually starts already in the prenatal phase when we still have to be born, because already there the interaction of parents, of mothers, especially, of course, with forests can have an impact. And then we go all the way through the stage of the elderly that are also in many ways dependent on forest and trees. So I won't say very much about this because Payam will cover this in greater detail. Just some of the highlights in terms of the evidence that is as mentioned in the report. So for most health outcomes, we find that the observed associations are predominantly beneficial. So forests and trees have a lot of positive effects on our health and well-being. For some of those associations, we have stronger evidence. For example, mental health and well-being or longevity are strongly have been found to be strongly correlated. While for others, for example, cancers, the research is still pretty new and pretty, we'd say almost like premature. So we still need much more research in that direction. For some of the health outcomes, we see more mixed evidence, and this is really detailed in the report, with sometimes positive, but also sometimes maybe less positive associations. And also here it's really important to highlight the issue of context. So in a nutshell, most of the research on forestries and health has taken place in the global north, in the let's say the high income countries and maybe medium income countries in some cases, and also very much in urban areas rather than maybe in rural or forest dependent communities. So there's definitely a skewed evidence base at this moment that we have to take into account. Which is not to say, of course, that the health impacts of forest are extremely important also in those much understudied areas. And we need much more work to be undertaken there. So yeah, I already mentioned the issue of context. So the report really takes that approach very much. So we focus on three main contexts. We look at the urban context, we look at rural context, and we look at forest proximate or forest dependent communities. And here, of course, the health relations between people, forest, and trees will be different. So in urban areas, for example, there's a lot of focus on using trees and green spaces to improve mental, physical, but also social health, for example, by recreation or maybe in some cases by cooling cities. In rural areas, there could be a lot of links to rural livelihoods, being able to make a good living. Maybe there could be issues of nutrition. And for forest-dependent communities, of course, there's much more direct links between using the forest, being dependent on the forest, living in the forest, and health and well-being. So throughout the report, these different contexts are recognized and woven into the findings. In chapter 5 in the report, you will see some of the response options that we suggest or that are available for enhancing positive impacts of forests and trees on human health. And these have to do with anything from governance and for example, linking forestry policies with policies for example, medicine and for health, to things like design. So we could design forest environments better, for example, in cities. And here's an example of soundscape design. We could also look at things like communication, education, and make sure that the connectedness to nature is enhanced so that people feel more connected, are more connected to nature, which is also known to have many positive health outcomes. And with the connectedness to nature can also come things like better management, better recognition of forest and trees. So yeah, quite a few things. We looked at issues like spatial recognition of the health dimensions. For example, how do we bring forest and trees close to people where they can give most benefits? So yeah, quite a range of response options are offered here. Then the key messages, once again, illustrated by Karen Grönberg. So key message 1 is that forest, trees, and green spaces impact human health across all life stages. I already mentioned this. This is definitely not limited to the elderly or to mature people or to children. At all life stages, there's a strong link between us, forest and trees, when it comes to health and well-being. Key message 2 is that the positive health outcomes of forest and trees and green spaces significantly outweigh the negative ones. So although, of course, recently we have had a lot of focus on zoonotic diseases like COVID or SARS, etc. We have, of course, issues in terms of, for example, forest fires. But when you look at the overall picture, forests and trees are really good for health and well-being. So it is really our task then to optimize those positive outcomes, while, of course, also managing and minimizing some of these potential negative effects that, as said, really have to do with disturbed forest-people relationships and with the forest itself. The third key message is that the health outcomes of forest are the results of a lot of different pathways that are dependent on context. I already mentioned urban, rural, but also, for example, high or low income countries and individual lifestyles. So often, of course, these relationships are very complex. And in some ways, in some cases, we know why specific forest or tree environments have specific health benefits. In other cases, we are still to really find out what are the exact mechanisms or pathways that deliver these health benefits. And the more we know, the more we can also guide policy and planning and management towards optimizing those benefits. Key message 4 then really says that forest health relations offer solutions, partial solutions to global health crises. And here you could think about, for example, global pandemics, global health challenges, but also climate change, where, of course, restoring forests is good for health and well-being in different ways, but also, of course, contributes to climate change mitigation. So there is really a way here, a pathway, we would say, through forests, trees, and their links to health that we can deal with and contribute to some of those solutions. And finally, key message 5 is that integrative and cross-sectoral approaches are needed to really link up these often very distinct and separate, even siloed policy domains, for example, between forestry and the health policy domain. But here, of course, there are many other domains that have to link up and find integrative approaches that take these relationships into account. And here, I think a lot can be gained from using One Health, Planetary Health, EcoHealth, and other similar integrative frameworks. Yeah, then moving towards the end here, we also identified, based on, of course, on this extensive research assessment, some of the knowledge gaps and research priorities that we see. There's definitely a need for more rigorous methods and studies. We have seen during recent years a very good increase in some of those very high level, very strong methodologically designed studies. We see also that studies about forestries and human health start featuring in some of the top medical journals, which is a really good development, but we still are in a process here. We still have to really enhance those studies to really make sure we get better evidence also on those mechanisms and pathways. We definitely have to study different populations and contexts. There's a strong skewing, as I mentioned, towards high income urban contexts. So we have to make sure that we look at things like spirituality, medicinal plants, but even physical mental health impacts in, for example, rural areas in low income countries. Then we need to strengthen the valuation, assessment, and sharing of health benefits and costs. We have to really, also in terms of our links to the healthcare sector, make some of these benefit and costs more explicit, make sure that these are recognized also in policy processes, so that we can start developing integrative policies for forest health relations. Broadening the scope, I already mentioned that health aspects can be very diverse, and that could include things like spirituality. They could include things like the role of medicinal plants. They could include many different individual relations that people have with forests and trees. So we need to broaden the scope beyond more classic, maybe health studies. And then finally, of course, one reason why we are here today, there's a strong need to strengthen the science policy interface to make sure that the research that is taking place has taken place. The evidence base, which is definitely getting stronger, is also fed into the relevant policy processes at the global level, but also at regional, national, and even local levels. For example, in terms of, for example, spatial planning around the city. And it's very good to see that actually some of our messages are going to find regional channels, policy briefs, and so as well, so we can really identify and focus on some of those regional challenges that are existing. So finally, as my time is ending up here, the challenge ahead, as we can see it in two very general statements, but still very important statements, I think, we need to transform towards integrative policies and initiatives for forest health outcomes. So I think this is really, as we as a panel find, crucial. If we want to move forward, we cannot stay within the forest policy domain, we cannot stay within the medicine domain or the health domain, we cannot stay within the ecology domain. We really have to start bringing this all together for more integrative approaches. And as said, rather than saying that the forest would be to blame for some of these negative health outcomes, it is really about restoring disturbed forest-people relationships, to bringing the forest back into our lives, to make sure that we also take good care of the forest, conserve it, and manage it appropriately. And in this way, we can optimize benefits, while on the other end, we minimize some of the negative impacts that we have seen. So with that, I would like to pass it back on to Christoph.
Thank you very much, Cecil, for nicely summarizing the outcomes of our assessment and for setting the scene for our following discussions, actually. If you have any questions to Cecil, please post them in the Q&A box. We will let them respond to the questions, Cecil and the others, after the following speakers. And we can have as many questions as time allows. Well, with that, I would like to introduce you to the panelists. Our first speaker in the panel discussion is Matilda van den Bosch. Matilda is a senior researcher at the Barcelona Institute for Global Health in Spain and an adjunct professor at the University of British Columbia in Canada. She's working on environmental impacts of human health, environmental impacts on human health, and served as coordinating lead author of the report. Matilda will briefly outline relevant transdisciplinary conceptual frameworks for assessing the interlinkages between forest and human health. Matilda, you have the floor.
Thank you very much, Christoph, for the nice introduction. Yes, so I was coordinating lead author of chapter 2 of the report, where we're trying to frame the interrelations between forests and human health. So what is health? The World Health Organization defined human health as a state of complete physical, mental, and social health and well-being. And it has also been defined as the capacity to adapt to one's environments. And this, interestingly enough, reflects or corresponds to the ecological definition of the forest or environmental health as resilient and capable of maintaining functioning systems. Hence, we can see already from start that there is human health basically equals forest health already by definition. So what has happened then with health among humans versus forests? So humans are healthier and live longer than ever before. However, this has come at a cost of environments and forests that have, so forests have sort of paid for our anthropocentric needs and the anthropogenic way of living. This has resulted in biodiversity loss, environmental degradation, and climate change, and so on. And seeing that we are, as a species, completely dependent on healthy ecosystems, this is naturally a major reason for concern. And we, even though health in general has improved, we see increasing global inequalities in health, and we also know that future generations will have to pay. We're talking about an intergeneration inequality, so future generations will have to pay and suffer poorer health in comparison to what we do today, because of the way we are living and the way we are degrading our environments and destroying ecosystems. And what can we do? What can be done in order to address this? I think we need to change our way of thinking. Planetary health is an approach where human health is addressed by a systems way of thinking, systems thinking where we shape the Earth's natural systems within safe limits where both humans and environments can thrive and flourish. This means, as Cecil already said, that we need to collaborate across disciplines, across national boundaries, as well as across knowledge systems. Okay, so taking us back then to the pathways that Cecil also mentioned briefly between forests and human health. First of all, I would like to mention biodiversity, as that is the fundament for everything. We need biodiverse ecosystems for them to function. We need biodiverse environments for the planet to thrive. More specifically, some research also suggests that biodiversity is very important for our immune systems to develop and function. What we often also talk about, particularly for urban forests, is the socio-behavioral mechanisms, where we know that the access to green spaces, for example, promote physical activity, it enhances social cohesion in communities, and it also contributes to stress reduction. Another important aspect of how forests can improve human health is through the regulating ecosystem services, such as reduction of the urban heat island, reduced levels of air pollution, and lower noise levels. Finally, in more forest-dependent communities, I think that provisioning ecosystem services like food, nutrition, clean water, fuel and timber and so on are very important, of course, for the thriving and health of people in these communities. So with this, I would like to hand back to Christoph, and wish you all a continued good day. Thank you.
Thank you very much, Matilda. I immediately will introduce our next panelist, Payam Dadvand. Payam is an associate research professor at the Barcelona Institute for Global Health in Spain, and he's working on the impact of both environmental stressors and environmental mitigation measures. Payam also served as a coordinating lead author of the report, and he will highlight current evidence on the impacts of forest and trees on human health at different life stages. Please, Payam, you have the floor.
Many thanks, Christoph. First, I would like to acknowledge, the contributions of a long list of authors who contributed to the development of this chapter, without whose contribution it was impossible to gather, this huge amount of evidence and then, to formalize it in a coherent way. And yes, next slide, please. As Cecil mentioned in his introduction, so we evaluated and then provided an overview of the available evidence over the different life stages from pregnancy period into the childhood and adolescence and then adulthood and finally elderly and death. If we start with the perinatal period, which is the first stage of life, available evidence is quite consistent when it comes to the fetal development and birth weight. Meaning that evidence is showing that those mothers who are living in greener neighborhoods or have more contact with natural environment, including trees and forests, they are more likely to, give birth to children with higher birth weight. And they have lower risk of delivering a low birth weight child, which is newborn, which is a child with a birth weight of less than 2.5 kilograms. The available evidence for the same, exposure to preterm birth is rather inconsistent. Some of the studies showing that more of use of green spaces and contact with nature could reduce the risk of preterm birth, but the others are not showing the same, association. Also, the same goes for pregnancy complications, just like gestational diabetes or hypertensive, problems of pregnancy, just like preeclampsia, for which some studies are showing that contact with natural environments or living in greener neighborhoods could reduce the risk of these pregnancy complications, but the others are not showing that. When it comes to childhood and adolescence, the most solid evidence that we can see is about mental health and neurodevelopment. Earlier, let's say experimental small-scale studies were showing that we were supporting of some sort of therapeutic or short-term effects of contact with nature in a very brief way, just half an hour walking in a park or in a forest, could reduce the symptoms of children who were suffering, for example, from attention deficit hyperactivity disorder or ADHD, and also could improve their mental health. And more recently, a substantial body of epidemiological evidence has shown that even also raising up and living in greener neighborhoods and also going to greener schools is associated with improved neurodevelopment in terms of cognitive development, behavioral development, motor development, and emotional development, and lower risk of neurodevelopmental disorders just like ADHD. Regarding the cardiometabolic health and development, the available evidence is a bit mixed. So some studies are showing that, for example, the more use of green spaces by children and more playing in the natural environment like forests could reduce the risk of, could reduce the blood pressure and also could reduce the risk of having high levels of blood lipids or blood sugar levels. But the other studies are not showing that. So, still, this is an emerging area. For respiratory and allergic outcomes, it's one of the really heterogeneous evidence that we do have about the effects of natural environment, trees and forests, because on one hand, these environments, they can reduce the air pollution, they can increase the physical activity, and also they can train the immune system through enriching the microbial input from the environment. And on the other hand, they can increase, so by these ways, they can reduce the risk of developing respiratory and allergic outcomes, just like asthma or hay fever and those sort of things. But on the other hand, they can generate pollens. So they can, provide, they can provide, risk by they can generate risk by, risk of exacerbating of the already existing issues, just like asthma attacks or hay fever attacks. For the infectious diseases, again, the available evidence is quite heterogeneous and can go both ways, because on one hand, a poorly managed, let's say, interaction between humans and forests could expose humans to the vectors or reservoirs of infectious diseases, just like malaria, that are hosted by the forest. On the other hand, the forest can provide the biological control of the infectious diseases. They can train the immune system, and also they can provide medicinal plants. Same pattern of evidence we can see for malnutrition, because on one hand, forests, especially for the forest-dependent community, they can provide, I mean, dietary diversity and also food security, and also indirectly by providing, income to forest-based products, they can, they can give those, especially those communities, access to the, food market. On the other hand, again, the poorly managed interaction between humans and forests could result into, higher risk of maybe zoonosis, that, as we saw, for example, for the SARS pandemic, and perhaps for the COVID pandemic, that, this interaction could have played a role. When we go to the adulthood, as Cecil also highlighted, for mental health and mental well-being and quality of life, we have solid evidence that contact with natural environment, including forests and trees, could improve the mental well-being and quality of life. For mental disorders, just like, depressive disorders or anxiety disorders, although, the evidence is suggestive for such a, beneficial effect and reduced risk of these disorders in association to contact to natural environment, and also the therapeutic effects of natural environment, just like forest bathing on a number of these disorders, to reducing their symptoms. The evidence is still, evolving, and we need more evidence to be able to, to establish this effect. For spiritual well-being, although we have good evidence that forest, especially forest, can improve this spiritual well-being for those societies who see values in that. And for infectious diseases, just like the one, as I said, for children, we can have on both either ways. We can have increased risk, and also we can have reduced risk of infectious disease depending on how we interact with the forest. For cardiometabolic health, we are seeing, a strong evidence of beneficial effects of contact with natural environment, with forests, and also urban green spaces, with the risk of cardiometabolic conditions, just like diabetes or ischemic heart disease or myocardial infarctions, both morbidity and also reduced mortality. And for respiratory and allergic outcomes similar to children, the available evidence is very heterogeneous depending on how they look at it. So they could increase the risk of attacks in those who have pre-existing conditions, and also it can be preventive for these conditions. For the cancer, the available evidence is quite limited at the moment, and it's quite mixed, because for some of the cancer, just like skin cancers, even there are reports that are showing that more green spaces around, for example, your home could increase your risk of skin cancer. But for some others, especially hormone dependent cancer, just like prostate cancer or breast cancer, the evidence is suggestive for a protective association between green and natural environments and those cancers. And when it comes to elderly, the available evidence is quite established about the potentials of the natural environment and forests and trees in decelerating the cognitive aging in elderly, and also reducing the risk of dementia, diseases just like Alzheimer's disease. And the same we are seeing for the physical functioning decline and frailty among the aging elderly. But again, here the evidence is still limited and is still mixed, and we need more evidence to see. For mental health and well-being and quality of life, just like adults and just like childhood, the current evidence is quite solid and are indicating that more contact with natural environment and more availability of these environments, including forests, could increase, the mental health and well-being. And for longevity and mortality, again, current systematic reviews are clearly showing that living in neighborhoods with more green and also more contact with greens is associated with longer life and longevity, and also reduced risk of mortality. So yes, and also as Cecil mentioned, that there are a number of gaps in the knowledge, especially both in the context when it comes, for example, for low and middle income countries where much of the urbanization currently are happening, and also for the forest dependent communities for whom we don't have much of evidence yet. And yes, by saying so, I can leave it again to Christoph to go ahead with the presentation. Thank you so much.
Thank you very much, Payam, for this quite comprehensive overview on the current evidence that we do have on the impacts of forest and trees on human health. And with that, I will continue with the next speaker. Our next speaker is Agnes van den Berg. She's an environmental psychologist who specializes in research on health benefits of nature and on people-environment interactions. Agnes served as a coordinating lead author of the report and will share with us insights on different response options that can enhance the positive health impact of forested trees while also minimizing the negative impacts. Please, Agnes, you have the floor.
Thank you, Christopher. First of all, hi all. I apologize for looking a bit mossy because the screen is, the camera is not working. My camera is not working very well. So I also think it's mirrored. But so I was together with Cecil. I was coordinating lead author of Chapter 5, the response options. It was quite a challenge to design this chapter, but in the end we took quite a systematic approach. First, we identify 5 themes that are relevant to health benefits of forest, and the themes are maybe the next slide. Can we see? Can we show? Yes, access, spatial dimensions, design, communication, education, and governance. And so each of these themes provides starting points for taking the health benefits of forest into account. We also did, I don't think somebody said it yet, but we had a critical review. And for our chapter, one of the comments on the previous version was that the relevance of the response options differs between different parts of the world, and also between more urban and more rural areas. And so that's something to keep in mind when you look at these response options. The approach we took was for each of the themes. We identified the factors within the theme that are relevant for the relationship between nature and health. Sounds a bit abstract, but once you identify these factors, you can they provide entry points for solutions, and we deliberately called it solutions. It's not a prescription for recommendations or guidelines of what you should do, but it's possible solutions for action that you can take in these different domains to promote the health benefits of forests. That said, there are 5 response options. Of course, I cannot discuss them in detail. The first one is very relevant in the low-income country part of the world, access. And to me, that was kind of an eye-opener working in such an international team, because living in the Netherlands, when I think of access and nature and health, I think of being able, living near a forest or a park. So being able to enter, being usability for people with disabilities. But access more globally worldwide, of course, is about being able to derive the health benefits of the forest, and that already starts with food that you can take from the forest and a clean environment that is provided by the forest. And the factors that are relevant for this theme of access, especially, which is especially relevant in these low income parts of the world, are property rights, and capitals. And property rights is whether you own the forest or whether you have a right to use the products of the forest. And capitals are about the background resources that people have to derive benefits of the forest. And you can think of, for example, income as a very important capital. And the basic, the main solution from that comes out for this theme is to reduce inequity in these capitals, because especially vulnerable populations and communities, they have less access, less property rights, and reduced capitals, and strengthening the property rights and capitals can help to enhance, to use the health benefits of forests. So that's a rather, that was access. And the second theme is spatial dimensions. I think it's a bit more familiar for people working in forest management. Of course, the dimensions, the factors relevant to spatial dimensions are things like distance, size, but also, especially for health, the spatial arrangement, how the forest plots are patterns in a certain area. And the main conclusion from this response option that is relevant in all parts of the world, I think, low income, high income countries, is that health is often not explicitly, like Cecil already said, it's a general conclusion, but it's especially in the spatial management, it's often not included as an explicit criterion for spatial management of forests. So the solution that we propose is that health should be included more explicitly, also in tools like to the woodland access standards. And we also, as a solution, say that we should look at the people, decision makers, managers should look at the negative aspect, because it's not always a good thing for your health to live near a forest. Think, for example, of wild animals, but also wildfires. Then the third theme is the design of forests. It's very important for the healthy effects of forests. For this theme, we identified as a basic starting point that people have different needs in relation to forest and health, and that range from very basic needs of safety, for comfort, of accessibility and usability, that people want positive experience, and they also have the need for more challenge. And these different needs are fulfilled by different design elements, and we give a long list of these design elements and how they fulfill all these needs. And the solution is to balance these needs and the design elements. What we also say is that when designing forests for health, it's important to provide infrastructure for people with disabilities, and to take a multidisciplinary approach, not only architects, but also people from managers, but also with a social science background. And for each of the themes, we also identified, we highlighted kind of a specific theme. And for design, we highlighted the COVID pandemic. And a lot of research was done, a lot of experiences where managers had with the design. And we can learn lessons also from this COVID pandemic for the design of health promoting forests. Communication and Education is also a theme for response options that provides response options. So we split that up in communication, education. For communication, we said there's a lot of focus at the moment when it comes to communicating about health. About that, like what Payam just said, the evidence, the effects, the health effects of the forest, but and that is important for people to take action, but also, and I think it's already said, people need to understand why forests are promote health, what the mechanisms are behind the health and forest relationship, and these mechanisms are often not so well known. So more focus could be on these mechanisms, for example, the strengthening of immune system or perception of fractals. We think a shift in focus is important there. And for education, it's all about reconnecting children, but also adults to the forest. And when people are connected, they derive more health benefits. And for that connection, it is very important to enable people to have hands-on direct experience with the positive health benefits of forests. And yeah, I was thinking for this, yes, the positive. Also, we gave a little bit of attention to the importance of in the school system, acknowledging so we have an audience from all over the world, and it's relevant for, especially for low-income countries, to have to acknowledge the traditional knowledge of children in the school system. And finally, we have, of course, as a theme, the governance, which is not really my background. I'm a psychologist, so I think this is mainly written by one of the co-authors. What I understand from her analysis is that it's very important some innovation is needed in the governance by building new alliances between government actors, with markets, with civil society agents, with NGOs, and through that, through these new alliances, create new opportunities for integrating the health benefits in governance and policies. I think that's a little bit it. I hope it's not too abstract, because yeah, there's a lot of information. It's a wide array of themes, but I hope you at least that will give some inspiration for coming into action.
Thank you very much, Agnes, for these insights into the different response options that we have. I think we got quite a nice overview now on the key outcomes of this assessment, and also on the different aspects, actually. And this would be the basis for a further discussion now. If you have not done so yet, please post your questions in the Q&A box, but I see there are many questions already, actually. And if there are similar questions, I will also combine them. And the first question I have goes to Cecil. Cecil, the question is, can urban trees tackle health impacts from global issues such as global warming and heat waves? And how can we integrate urban forestry into the urban public health strategy? What would be your opinion on that?
Great questions. And the answer is to the first question is yes, definitely. A very interesting study came out just a few weeks ago by a group of researchers led by Dr. Jungmann, I think, from ISGlobal. And they found that having a 30% canopy cover in cities can actually reduce the number of excess deaths because of heat waves by 1/3. This was published in The Lancet, so of course a very respectable journal. And this really highlights, I think, the impact of trees on cooling in cities, which is an essential service. So I think this is really starting to be recognized. And to actually then answer the second question, or the second part of the question, the Biden administration in the United States has used urban forest as a tool to fight heat in especially vulnerable communities in cities throughout the United States, and has invested multiple billions to green cities and green vulnerable areas. And in that sense, also then to improve local health. So I think that's an example of how actually trees and forests start being integrated in health strategies. But this happens still too little, I would say. And we hope to, of course, see more of that.
Mm-hmm. Thank you very much, Cecil. The next question goes to Matilda. Are there some existing methods and/or indicators to measure the health benefits of forests? And are there any promising new approaches to that, measuring the health benefits of forests?
There are a number of research methods for measuring the health benefits of forests, the different research designs, the different methods. What is tend to be used is, like Payam mentioned, the epidemiological methods, using different exposure measures, where there are a number of different, using, for example, satellite and remote sensing to calculate indices of the greenness, and using land cover and land use maps, we can more best define forests and what types of forests, for example, like deciduous forests versus coniferous forests and so on. And this can then be linked to a number of different health outcome data. We typically use cohort data or register data on medication use and so on. So this is the this is one type of research design. Of course, we can also use experimental studies or natural experiments and so on to measure the health impacts of forests on human health.
Mm-hmm. Thank you very much, Matilda. And I have a question to Payam. Is there any demonstrated relationship between tropical forest degradation and the spread of zoonotic diseases?
Yes, I mean, the association between deforestation and zoonotic diseases is quite complex. So it depends on the context. In some countries, in some contexts, you can see that this deforestation could increase the risk of zoonosis. Mm-hmm. And in other, for example, for malaria. And in the other context, for the same malaria, you can see that it decreases the risk of, let's say, zoonosis. So it depends on the context, and it depends on the infectious disease that we are talking about, the interaction between, the forest, the reservoir, the vector, and the humans. Depending on all the complex interaction between them, it can go either way. So there are evidence for either ways on this. Yeah.
Mm-hmm. Thank you very much, Payam. I have a general question, but I would direct it to Agnes. With rapid modernization and the strong integration of technology in society, how can we promote the role of forests and their importance to human health?
Rapid, what are you said, rapid?
The rapid modernization and the strong integration of technology in society. How, like with this development, is there any role for that, for promoting forests and their importance for human health?
Yes, actually, I think we touched a little bit upon it in the discussion of the communication and education approach. And in general, I would say personally that often people think that things like increased screen use and technical advances are like are a threat that prevents people from reaping the benefits of health benefits of nature. But I think it can be complementary, and especially in communication and education, there are examples of augmented reality that you can use, especially in the more high-income countries, that children can use, that attracts them to that inspires them to go to the forest and look for animals. And also, I think, and that's also for Payam, I think much of the research is done on health benefits of forests that is relevant for health benefits of forests, done with virtual or simulated nature. And it's also very, the findings of those studies are relevant for places where people don't have access to actual forest. You can still use technology to also people with disabilities to bring them in contact with forests and maybe even motivate them to later on go out and visit the forest for their own well-being. So I think there are a lot of opportunities there. Actually, we only touched upon it. So it's a good question.
Thank you very much, Agnes. We have so many questions. I continue with one for Cecil. Are there findings in the report that hold true to places that have remained traditional? If there are, will it be better to remain in the status quo in terms of the existing forest-human interactions in these areas? So should these traditional places stay as they are, or is it better for them to develop further?
Ooh, that's a very interesting question. Thank you very much.
That's why I gave it to you.
So we do definitely highlight in the report forest-dependent communities who have, of course, long histories often of interacting with forest, living in forest. And of course, over time, many of these communities have been affected by development in some form, however you call it. It's a little bit comparable actually to cities, where sometimes we see if we green neighborhoods, then actually the people who are living there, the vulnerable people, they're pushed out because house prices, apartment prices go up. But that doesn't always say, of course, that we should not green neighborhoods. So it's a very complex relation or issue. I think we have to learn from these relationships. For example, when it comes to things like spirituality and deep knowledge about the forest, and also some of the medicinal knowledge that is known by forest-dependent communities. So I think we have to really build on that. And I mean, we cannot freeze time, unfortunately. We have to be realistic about how things go. But I think there's a lot to be learned.
Thank you very much. I would also ask the others, but now we have so many other questions, interesting ones, that I might go on. Well, I would ask Matilda, are you aware of an example when integrative approaches such as One Health have been applied already?
It's another good question. I would say that, well, for sure, there are, especially in remote settings, I think One Health has been implemented. Planetary health is, I'm a little bit more aware about, which is increasing in recognition, and more and more calls coming out for conducting more research around this, where we do exactly these interconnections between the health of the environment and the health of humans, and how we can address this in the best way. I think where we need to start there, and where there should be some more studies going on, is exactly as we've been already mentioning within indigenous communities, and where we can apply exactly these traditional, or use traditional ecological knowledge to learn how to better understand these interrelations.
Thank you very much. I do have another interesting question for Payam, and very important one. Is there any life stage where the health benefits from forests are particularly important?
When we look at the, let's say, life course approach, which is one of the approaches that we take in public health, often when you think about it, the prenatal and early postnatal periods are the most important, let's say, stages of the life, because whatever exposure, environmental, lifestyle, or that you are exposed to during those periods of life can spill over for the rest of the life. For example, there are studies that have shown that if the child is preterm birth or low birth weight, then later in adulthood they have higher risk of cardiometabolic problems, just like diabetes, cardiovascular problems, and all that. So the more you invest during this vulnerable window, and also a window of opportunity, the more you get from the public health view through the life course, because then you can some sort of program the fetus and also the child to be healthy in later life. So I would invest mainly on the early life, where it is a window of vulnerability and also a window of opportunity.
Thank you very much, Payam. Yes. Agnes, a question for you. Are there cases where economic incentives for forest owners or managers have been designed or implemented to specifically promote the conservation of forests for health benefits?
No, just like Matilda, I'm not familiar with that literature, so I cannot say it right
Okay.
at the spot. But I want to say, maybe coming back on what Payam said, I agree with the perinatal phase of life is important for health benefits, but I would also stress the importance of the school age from about like 6 to 12 years, where all the literature points at that's a phase in life where children experience magical moments with nature that provides them with a deep connection. And that is also some research, and I'm sure Payam is also familiar with it, that shows that having those moments and those connections early in life also helps to seek out nature for health later in life, and that also applies to forests, of course. So it's a kind of basic foundation, the period where that is very critical in developing the connection with nature and the forest.
Mm-hmm.
And sorry for the other question, but that would be to expertise.
If anybody else would like to add anything to the other question, you're welcome.
I can jump in maybe on that, Christoph. So there are schemes available, subvention schemes, subsidy schemes in countries like the Netherlands, actually, in terms of forest owners opening their forest for recreational purposes. So in that sense, you could say there is there are some mechanisms in place for supporting people that are allowing access to their forest, and with that also promote health.
And I could add that I know some schemes like at a very low level in Austria too. Yes, I do have a final question for everybody of you, whoever wants to take it. How can we balance the provision of health benefits from forests with the different services that forests can provide to other sectors, such as income generation or carbon sinks? I mean, I think it's a very relevant question for the policymakers. Who wants to take up this question?
I can jump in to start with, I guess, as panel chair. I should have some idea about it.
Yes, please.
I think it's really important to realize that of course, in many cases, there are synergies between different benefits of forest, between services. And I think really the idea is to optimize those synergies. But of course, in some cases, there will be decisions to be made, like what do we want? What are the benefits we want to prioritize in specific cases? And I think this really requires, as we also say in the report, very careful policies, management approaches that will optimize benefits for local needs. I think our point is that health should really be moved up in the priority list. Right now, it's often a point which is still neglected when it comes to forest, and I think it needs to be taken more seriously.
Thank you very much.
And maybe Christopher.
Yes, please jump in.
Also good to say that we are now not. That's the chapter 4 that is actually, I think, about this issue, about the synergies and the trade-offs, and that also gives a lot of information on the answer to the question.
Yes. Thank you very much, Agnes. Yes, and Cecil has been also a lead in the chapter 4.
I can also say I have a point to add to that.
Yes,
I think
please.
What's interesting, and that we start talking about more and more, are the co-benefits, like the co-benefits of climate mitigation, for example, like carbon sequestration, as you mentioned that, would quite obviously have co-benefits in terms of if we manage to address climate change through carbon sequestration, then that would have an impact on human health subsequently. But also, if we manage to find out forest management strategies that are important for carbon sequestration, and then can add to that, for example, okay, we have forests for carbon sequestration, but these forests can also be used for say recreation if we have them at an adequate distance, for example, from where people live. And like with forest production forests producing income, also like income is obviously related to health. So I think we need to think about it in terms of co-benefits as well. Thanks.
Yes, thank you very much, Matilda. Any other statements on that? Well, then I thank you very much. I thank all panelists. We have to close the Q&A session now because we still have 2 other speakers. Thank you very much for these excellent questions to all of you, all participants. If you have specific questions, you can always approach the authors and ask them questions. I now will go to the third part of the event, in which we will hear reflections on implementation and decision-making. We have two distinguished representatives of UN organizations with us, with a mandate on forest and a mandate on health. I would like to start with Zhimin Wu, the director of the Forestry Division of FAO, the Food and Agriculture Organization of the United Nations. He's the chair of the Collaborative Partnership on Forests, the CPF. Mr. Wu, may I ask you to share your thoughts with us on this assessment on the interlinkages between forests and human health? You are muted, Mr. Wu. Sorry, I cannot hear you. May I ask?
Sorry.
Oh, yeah, now you.
Thank you, Christoph, and distinguished experts. And firstly, I would like to congratulate ourselves, those foresters, or people who are logging forest, on the International Day of Forest. And this is actually my fifth event of the day, and very it's my great pleasure actually to join the panel. So outside, I would like to thank IUFRO for inviting me to this very inspiring discussions on this International Day of Forest, and for the excellent work that IUFRO has been doing through the Global Forest Expert Panel and the Collaborative Partnership on Forests. And as we know, that is my language, forests are our origin and forests are our solutions. So forests are the source of food and nutrition for nearly 1 billion people around the world, and they contain many of the 50,000 plant species with medicinal values. They play a crucial role in combating climate change. The big carbon stock, storing 660 billion tons of carbon, about half of the carbon stored in the vegetative soil on the earth. They also are home to up to 80% of the biodiversity around the world. And without healthy forests, we would not have healthy communities, a healthy environment, or a healthy planet. So this is why we must put forest first if we are to achieve all the global goals, including the SDGs. But still today, forest loss and deforestation, degradation continue, actually to threaten the human health. Insect pests and diseases, they damage around actually 35 million hectares of forest annually. And the wildfire affected approximately 98 million hectares of forest globally. This is an astonishing, alarming figure. I joined FAO not for 3 months, but whenever I actually read these figures, I was astonished. Right, imagine how many hectares we plant every year. I came from China. It's 660 million hectares per year. Right, it's a huge afforestation program. But you see the area affected by fires, 98 million hectares per year. Jesus. So I feel obliged and committed actually to do whatever I can actually to contribute to the process of holding deforestation everything. So although the rate of deforestation globally is slowing down, but still 10 million hectares, right, of forests were lost each year between 2015 and 2020. Compared to the loss from the fires, this is relatively small, right? But we every day we say that we have very serious issue of deforestation. We have more serious issue of wildfires. So we are now working on a global platform of pre-warning right? So that we can identify the sparkles as early as possible to prevent the big fires. So we need to reverse this trend, and we need to scale up and accelerate actions now and together. Especially now I'm the chair of the CPF, and we have actually the resources available, but it's a matter of how to more optimize the resources we have, right? In CPF, we have UFRO, we have IOCN, we have the big donors, World Bank, GCF, GCF, GEF, right? And the real conventions. I think, yeah, we can do much more than what we are doing now. But we need strong commitments from all the same major players. Firstly, from the government, right? The responsibility is largely vested with the government, right? In the first place. And we as an organization, international organization, are here to help, to provide our technical expertise to help the government to implement actions on the ground. But we need commitment also from the private sector, civil societies, academia, right? And each of us individually. So we need to enhance greening of the earth through sustainable forest management and restoration of that provides benefits for people and benefits. So FAO program in support of Africa's Great Green Wall initiative is one of the biggest one around the world at the moment, is to address the issue of deforestation and the multifunctionality of forests. And there are so many other examples, but this is a matter of time, I won't actually touch those details. But enhancing actually understanding of the connection of forests to human health is also crucial in this regard, but it is often overlooked. The Global Forest Expert Panel publication launching today assessed the latest scientific information on the interlinkages actually between forest and human health, and present crucial evidence needed to inform decisions for improved policies. FAO is also promoting the One Health approach, which recognizes the interrelations of humans and the environment. It drives our work in transforming agri-food system for the benefit of people, animals, plants, and the environment. We need investment in agroforestry initiatives, so creating green jobs, generating livelihoods, and increasing food securities. And there are more and more countries and donors that are interested in actually linkages between agriculture, forestry, and livestock raising. So agroforestry will be it's a traditional, conventional, but will be a renewed concept in the coming years, right? With these interlinkages. And we need also to increase funding, research, and innovation, sharing data and best practices, etc. And FAO has nominated 2023 as the Year of Excellence, right? The Year of Excellence in our language is less but better, with high quality. So this is actually what we ought to be done, right? Not FAO, I think many others as well, because we tend to do everything. But it's better to prioritize what we are going to do and get a better quality, more impact on the ground. So let today's event be a reminder that forests are natural pharmacies. Healthy forests protect us from diseases, and forests boost our mental and physical health. And forests are our ally in combating climate change. With that, I would like to conclude my speech. Thank you very much for your attention. Back to you, Christoph. You are muted.
Oh, thank you. Yes, I was muted. Yes, thank you very much, Mr. Wu, for sharing your thoughts, and also actually for the CPF's continuous support of IUFRO's work at the Science Policy Interface. I think it's very important that we have an interface where we can share the scientific knowledge and where the stakeholders and decision makers can benefit from it and make informed decisions. With that, I would like to invite Cristina Romanelli, the Program Officer for Biodiversity, Climate Change and Health at WHO, the World Health Organization, to share her insights with us on the topic of forest and human health. Cristina, you have the floor, please.
Thank you so much, Christoph. I would really like to begin by thanking and congratulating the Global Forest Expert Panel and the IUFRO for extending an invitation to WHO to say a few words to celebrate this International Day of Forests, and importantly, for the launch of this report on forests and health, which I've found fascinating so far, and I'm exceptionally pleased to see that it very much coincides with and builds on the findings and key messages of a WHO and CBD-led State of Knowledge review on biodiversity and health that had been published some years back. So just for some context, I work within the Department of Environment, Climate, and Health at WHO headquarters, but I'm joining you today from Kruger National Park in South Africa, where I'm working with a range of multidisciplinary experts on a global assessment on the link between food, water, health, climate, and biodiversity. It's an assessment of the Intergovernmental Science Policy Platform for Biodiversity and Ecosystem Services, or the IPBES, which is now happening actually on the heels of a conference that we just had last week in Monrovia, Liberia, on One Health and protected areas, which was in itself followed by a consultation on the development of integrated indicators of mainstreaming biodiversity for nutrition and health. So why would I begin speaking to you today about these events in which we've been engaged in Western and Eastern Africa over the past week, addressing food systems and healthy diets, addressing One Health and protected areas, addressing response options at the nexus of food, water, and health, and climate and biodiversity? Because each of these events very much speaks to what we've heard so far, and they're essentially meant to catalyze policy actions. And if there is a common thread amongst them, it's that many of these response options lie in understanding and acting upon scientific evidence that enables us to sustainably manage, use, and restore forests, and the crucial role that forests play in regulating the ecosystem services that are so essential to our health and well-being. So these policy response options, I think, are particularly vital as we face a triple planetary crisis of biodiversity loss, of climate change, of pollution, which is happening concurrently with a series of global health crises of both communicable and non-communicable diseases. So I think that catalyzing our collective knowledge, such as through reports, such as the one that's being launched here today, and building on sectoral knowledge from conservation, agriculture, health, urban planning, amongst a host of other sectors, is more essential than ever to preventing disease and creating, but also to creating these health promoting environments through inclusive whole of government, whole of society approaches. So, but why does this matter from a health sector perspective? So as a first example, we know that terrestrial and aquatic, of course, ecosystems play an important role in disease regulation. We know that these relationships are complex, but with the advent of COVID-19 and many other emerging infectious diseases that have preceded it, we also know that the causal factors of the emergence of infectious diseases with animal origins that can lead to disease spillover from animals to humans include a combination of land use changes, such as those caused by deforestation and habitat fragmentation and degradation, increased human and domesticated animal contact, and of course, pathogen adaptation amongst, amongst other factors. But in a nutshell, to keep it as simple as possible, we know that human-induced land use changes are often the primary drivers of spillover events when pathogens cross over from one species to another and infectious disease outbreaks occur. But we also know that they modify the dynamics of endemic diseases, including those of both zoonotic and vector-borne origin and vector-borne diseases. So what does this really mean for policy options from a WHO perspective? Essentially, I would say the established links between forest ecosystem changes and human, plant, and animal diseases demonstrates the need for us to step up prevention measures and enhance detection and response actions that take into consideration all aspects of that animal-human ecosystem interface using a One Health approach that was referred to by one of the speakers presenting earlier. And I think it's important to know that over the past decade, infectious disease initiatives have also largely emphasized that human domesticated animal connections with natural resource management sectors being somewhat less involved and sidelined. And they've been also underutilized in efforts to face and prevent epidemic threats. So this is an opportunity to change that through the expanded definition adopted by the One Health high-level expert panel that was established last year. We now have an unprecedented opportunity, but also an imperative to engage the natural resource management sector to achieve a more holistic One Health approach, as endorsed by the Quadripartite Alliance, of which WHO is a part, of course, alongside the FAO, the World Organization for Animal Health, and most recently and importantly, also UNEP, and under which we've just launched a new joint plan of action. So for a question that had been raised by one of the earlier participants, do we have examples of One Health implementation? Absolutely. We have many national One Health platforms that are working to be more coordinated. Liberia, which I mean is the most recent example that comes to mind because we were there just last week, and forests and protected areas played an absolutely instrumental role. So if you're interested in learning about how these initiatives are being taken up at the country level, I do invite you to consult what is being carried out in some of those national One Health platforms. But there's also initiatives that are being led by a number of other stakeholders and NGOs. Health in Harmony comes to mind. They do terrific work in forested areas with Indigenous communities using an approach called radical listening, which has shown demonstrable benefits for forests to decreasing the rates of deforestation, and for human health, decreasing, for instance, childhood mortality and maternal mortality rates. So if I had to, if I had to summarize that in one message, I'd say it's really crucial and essential to engage with the natural resource sector, but also to make the health co-benefits explicit, using a One Health approach to reduce the risk of a disease that's associated with emerging infectious diseases of zoonotic origin, as well as vector-borne diseases. At the same time, I would suggest that policymakers could advocate the incorporation of emerging infectious disease risk assessment, risk management, and risk communication strategies in forest and land use planning. So this also involves, for instance, increased awareness of context-specific drivers of disease emergence and options to make safer choices in land use planning. But, you know, as we've seen, forests and trees are not only crucial to disease regulation. Forest conservation and restoration can also be a really powerful tool for climate mitigation and adaptation, and can be an important nature-based solution for health, which can help to reduce the large and growing burden of non-communicable diseases. So we've already seen from recent evidence from the IPCC, from the IPBES and others, that nature-based solutions can provide over a third of the climate solutions needed to meet the targets of the Paris Climate Agreement. And we also know, for those of you following the work of WHO on climate and health, that climate change has actually been identified as one of the greatest global health threats of our time. So the opportunities for maximizing co-benefits through ecosystem restoration and reforestation, through well-designed being the operational word there, tree planting activities, are potentially significant. For example, planting native trees in vulnerable and highly degraded ecosystems, together with preserving old growth forests, we know can provide substantial carbon sinks with associated benefits for climate change mitigation. But to fully realize the potential of ecosystem restoration and forest conservation, we can't only look at mitigation alone. We also have to be looking at what we can do in terms of climate change adaptation. There are options there as well. For instance, planting native trees in urban areas can reduce the heat island effect and provide opportunities for shade and cooling. And in fact, there are some tree species, such as the large leaf trees that have more surface areas for leaves and are able to better filter noxious particles from the air, and can contribute to reducing the enormous burden of air pollution, which every single year kills 7 million people. In addition to that, we've also seen some studies that show that tree cover can have a significant effect on nitrogen dioxide levels, and exposure to areas with higher density of trees can reduce the incidence, for instance, of asthma attacks. So I'm not going to go through the full range of benefits. We've already talked about infectious diseases. We've talked about nature-based solutions. And of course, as my esteemed colleague, Dr. Wu, also mentioned, they also have a crucial role to play in reducing the burden of malnutrition and diet-related non-communicable diseases. We know, for instance, that biodiversity loss, that climate change is disproportionately impacting on food security, food and nutrition security of smallholder farmers, of fisher folk, of indigenous communities whose food and livelihoods really depend on these renewable natural resources. And we also know that increased forest cover has been associated with better childhood and indigenous health outcomes, such as improved dietary diversity and reduced stunting and wasting, because of their capacity to provide food sources and forest-based income and pollination for crops, amongst some of the ecosystem services that forests provide. One that's been perhaps less mentioned, and I'm sure is in this beautiful, robust 250-page report, but that's also important, is bearing in mind that wild food from forests and agricultural land with tree cover can also really make an important contribution to dietary diversity, and they can increase the nutrient density of local diets and are of central social and cultural importance as well in many traditional and indigenous food systems. Equally importantly, forests also sustain resilience. We know that forest products are often consumed more frequently in times of food scarcity and that they can provide livelihood safety nets. When they reach markets, forest and tree products can contribute to identifying nutrition sensitivity options of global food systems, especially when the market chains are supported and developed in a nutrition sensitive manner. And finally, because we don't have time to cover that full range of benefits, I would like to also make a note of the important role of forests and trees on improving their potential for improving mental health outcomes. We know that planting trees in urban areas through the development of urban parks can also have benefits, mental health benefits, particularly for vulnerable populations, including those that are socioeconomically disadvantaged and elderly populations as well. And we also know that exposure to wooded environments has been found to decrease anxiety, depression, anger, confusion, and fatigue, with greater effects in people with higher initial stress levels, and can also slow the signs of cognitive decline, amongst other health benefits. So in a nutshell, we know, and I'm sure this report and many of the speakers that have preceded have exposed this beautifully, that the challenges that we face as a result of deforestation are numerous. But I'm also a strong believer that where there are great challenges, there are also great opportunities for more ambitious, coherent, and robust policy responses. In terms of policy responses, I've spoken about the importance of holistic cross-sectoral approaches to health, such as One Health, about the importance of considering multiple beneficial health outcomes, not only in terms of infectious diseases, but also in terms of non-communicable diseases and nutrition, about the importance of forests and trees in supporting mental health and well-being, including for disadvantaged or more vulnerable populations that are often most reliant on biodiversity and least protected by social protection mechanisms. But I also want to emphasize that from a science policy perspective, that systems landscape approach to food that considers the role of forests and trees must absolutely be at the heart of sustainable diets, not only to maximize nutritional benefits, but also to contribute to the broader aim of maximizing co-benefits for biodiversity and ecosystems, as well as human health. I'd also like to emphasize that need. We can't stress this enough, that need for policy coherence of actions that are taken under our global reporting processes, such as the UN framework for climate change and the nationally determined contributions, or the ones that are taken under the Convention on Biological Diversity, and how those can be reflected in national biodiversity strategies and action plans. And also to ensure that there is coordination and policy coherence with other key global commitments. We've talked about Paris, we've talked about NDCs, we've talked about NBSAPs, but we also need to consider the new commitments that we've made under the Montreal Kunming Global Biodiversity Framework, and how each of these in turn contribute to the Sustainable Development Goals. So with that, I would really very much like to applaud IUFRO and GFEP for the release of this a comprehensive state of knowledge on forest, trees, and human health report, and for bringing us one step closer to identifying a wide portfolio of policy responses, drawing from knowledge from multiple sectors and stakeholders. And we very much look forward to drawing on the scientific knowledge that it contains to design more holistic, comprehensive, and evidence-based policy options that meaningfully maximize co-benefits for planet and people. Thank you very much for the opportunity.
Thank you very much, Cristina. Thank you very much for this insightful talk, and also for sharing your experiences with us. I think you addressed most of the aspects we covered also in the report, and I think it will be very useful to further communicate and share our report with whoever is involved in decision-making at the interlinkage between forest and health. With that, but the participants, with that, we're coming to a close, actually. We're already over time. What I want to stress is just that what we've heard today actually completely confirms the importance of forests for ensuring healthy lives for all people on Earth. I mean, as we said already at the beginning, and then we also saw the need for the cross-sectoral and integrative policy approaches to achieve the SDGs. And I think all the future policies and initiatives in both the forestry and health sectors must broaden the scope to design holistic and impactful solutions to this topic. I stop here, and I sincerely hope that our publication will support a more coherent policy dialogue about the role of forests in supporting healthy lives globally. I would really like to express my sincere thanks to all the speakers in this event, and especially to all authors and editors of the publication. And we also have to thank our donors, without whom none of the work presented today would have been possible. Dear participants, sincere thanks to each and every one of you for joining our launch event. Our report on forests and the associated policy brief are now available for download at the IUFRO website, and the link will be posted in the chat. You can scan the QR code on the slide that you're seeing right now. This recorded session will be available on IUFRO's YouTube channel, and hard copies can be ordered from the IUFRO headquarters starting in 2 weeks' time. With that, I wish you all a good day, a good evening, and a good night. Bye-bye.